Hello, I'm Dr. Delaney, facial plastic surgeon and rhinoplasty specialist. Have you ever wondered what the inside of the nose looks like? Well, today's your chance. We're going to take a look at some endoscopic images of how the nose looks like on the inside. So starting off, we're going to look, this is an endoscopic picture of the right nasal passage, so just inside the nostril. You'll see this pink covering over everything. That's the nasal mucosa. So that's the lining, much like the skin for us on the outside. On the inside, we have a more pink lining, and this lining covers the entire nasal cavity. You may see these little red dots or red streaks, and those are all the blood vessels within our mucosa. The nose itself is very vascular, and you're going to see a lot of vessels inside, and that's normal. So starting off, when we're assessing someone for nasal obstruction, we're looking at multiple structures because it's not just usually one site where there's some obstruction. We'll usually start by looking at the nasal septum, which is that structure that you're seeing on the right of the screen. And you can see it has a lot of undulations. And that's because the septum is not one single entity. It's not like a wall like many people will think of. It's formed by the confluence of a lot of different structures, including cartilage and different pieces of bone. So it's pretty normal for the septum to have kind of undulation and ins and outs. And it's also up to the surgeon to figure out whether those undulations are clinically significant, meaning are they contributing to trouble breathing, or are they a normal part of the anatomy. After looking at the septum, then you want to look at that structure to the left. Inside the nose, we have these paired structures where they're outcroppings of bone covered with erectile tissue, and these are called deturbinates. Deturbinates are really important because they're involved in the heat and moisture exchange of the nose, so we can't do without them. However, sometimes the turbinates, especially in those who have bad allergies, can become almost chronically engorged, and then they cause nasal obstruction as well. So we definitely want to look at the turbinates as well. In fact, in those who have really bad congestion, we actually will look at the nose as is, and then we'll put some decongesting medicine in, and then reassess the nose again to look at the anatomy to see how things have changed. Lastly, when we're looking at the nose, we also want to look up top at this little angle formed by the side of the nose and then the septum. So that's called the nasal valve. That's the most narrow part of the nose and the most critical at assessing when we're determining sources of nasal obstruction. So in this next photo here, you can see we've moved basically further back into the nose. So we were originally in the front. Now we're about halfway between the nose and the ear. So what we're looking at is the back of the nose. The back of the nose goes into what's called the nasal pharynx. Naso for nose, pharynx for throat. So the nasal passage basically joins the back of the throat before turning down. Now you can also see really cool here is on the left-hand side, you see that little tubular structure. So that's the opening of the ear. That's called the eustachian tube. So that is the right ear opening up into the back of the throat. And because of that connection, that's how we're able to pop our ears. For instance, when you go like that, like when you're on an airplane, that allows us to blow air into those tubes to open them up to recalibrate, repressurize the ear, the air behind our eardrum, basically. And lastly, we have an endoscopic photograph of the left nasal passage, and no comprehensive nasal exam is complete without looking at both sides, obviously. And on this side, you can see we're looking at the septum. Now we're on the different side of the septum. The septum's now on our left side. We've got an inferior turbinate on the right side. The other structure you can see above it is the middle turbinate. And of course, the nasal valve is formed at the junction of the nasal sidewall and then the septum as well. And so we look at both sides of the nose, both at rest as well as dynamically during breathing, to really get a good feel of what structures are contributing to trouble breathing.